Hello, Virginia. It is 4 o'clock. Today, we're going to be talking almost exclusively about the coronavirus and an update, and then we'll take questions on a variety of topics. But let's start the way we always start, given we are in a worldwide health pandemic and in a time of change in our society, by reminding ourselves that we're going to get through this, and we're going to get through it together. So say it with me. We're going to get through this. We're going to get through this together. And one last time, we're going to get through this. We're going to get through this together. And hopefully the Kentucky that we build as we come out of COVID-19 is one where we are more together. All of us as one community, as one Team Kentucky, ready to take on the challenges of the future, but knowing that if we are more united and more connected, there is so much more that we can get done. Given that we have seen a bit of a rise in our cases, I think it's important for us to start off remembering our healthy at work rules. We have seen, but since people have started going back to work, again, an increase of cases that doesn't have us concerned yet, but what it shows is that we could do these rules better. So remember, just because we are going back to work, just because restaurants are opening, just because we can get together with groups of 10 or less, and even with the sizes of those increasing, these are all incredibly important. 10 or less doesn't mean that you don't have to socially distance yourself. You do in that. You should meet outside as much as possible. Right now, that appears to be a very powerful way to make things safer, and special accommodations. This is where, whether it is workers, when we talk about going back to school, educators, children that fall into high-risk categories, we have to make sure that we are making special accommodations for those individuals, knowing that COVID-19 can be deadly for those that are at the most risk because of age, because of heart, lung, or kidney disease like diabetes. So let's make sure as we put together our plans and as we move forward that as long as COVID-19 is out there, as long as we are still operating without a vaccine, these are really, really important. So I'd ask every business out there and all of the employees, take another look on our website, kycovid19.ky.gov, to make sure that you are following these rules. And if maybe you're not doing them as much around the office, think about ways to do them better. We've seen in some different areas where we have had some outbreaks, and let's make sure that your place of business, your place of worship, your venue is not one where we see the coronavirus spreading. So follow these rules. Now, I've gotten away the last couple weeks of reminding people something incredibly important to our rebuilding effort, and that's rebuilding every community and making new investments in several communities, and that's fill out your census. We've fallen, I believe, to 14, where we're actually tied with a couple of other states. This is the critical federal funding moving forward, and it's going to be for, I think, almost a decade that they will base it on it. This is our one time and our one chance, simply by going online and filling it out, less than 2 minutes, simply by making this phone call, that we can ensure Kentucky has the type of favorable treatment from the federal government to make sure that we move ahead and to make sure that we care for those that need our help the most. Please fill out your census. And please vote. Now, more than ever, voting can be easy and safe, even in a worldwide health pandemic. And that's because everybody can register for an absentee ballot. I've done it. You can do it too. You go online, you can verify your information very quickly, and it'll be mailed to your home. We want everybody out there who has means to an electronic device and has an address to sign up for an absentee ballot. You got to get it done by the 15th, so you don't even have a week left. Make sure you get online tonight, or do it right now. Try to listen while you're doing it, and order that ballot. Again, democracy is the most important form of government that we embrace, and voting is the bedrock principle of democracy. We need more people voting. So to me, I don't care what your party is, or even who you're planning on voting for, just make sure you register to vote, make that voice heard. To our young people out there, we have seen so much activity and even activism over the last several weeks from you. Make sure you register to vote. It is a powerful way, if you're looking to change the world, to change the world. But this is your say in helping elect the leaders that we see here today and the leaders that we would see tomorrow. All right, we're going to go right in to COVID-19. At this point, we have seen COVID cases in all but one county in Kentucky. This isn't the most updated map. This is from several weeks ago. I believe that Robertson County is the only county that we don't have a COVID case on, and I don't know if we can pull up the web page that would show it, but that'll show you the most recent one. And in fact, we have counties all across Kentucky that even fall into the darkest shade, meaning we've had a number of cases there. It means the virus has no geographic boundaries, and any place can quickly become a hotspot. I get the question asked that we don't have that many cases here. Well, there weren't that many cases in Warren County until suddenly it was one of the fastest growing counties in America in terms of cases. So let's make sure that we don't take anything for granted, that if we have a low number of cases in a county, we feel blessed, and we know it's also because of the hard work going in, and let's continue to put that hard work in to make sure. You got it? Oh, okay. So everything but Robertson County is actually in the 1 to 10. It's just very hard to see the difference between that yellow and the white. So the only thing that's actually up there in white is Robertson, and everything else is 1 to 10 cases. Okay, so this week, we've seen cases increased. We've seen some days that it is lower, and today we're right about in between, reporting 191 new cases of COVID-19. While we do not, we're not currently in that decrease that we had for at least a couple weeks, we do not see day after day a continuing increase, and that's good news. So what we'll be looking for now is are we going to jump kind of up and down as we move forward? Do we find a new plateau? With the additional testing we're doing, are we finding more asymptomatic cases? We got to look at all of that, but we're going to look at this and other numbers each and every day. 191 is within a range where we believe that it is controlled. Of course, we'd like 0, and given that it can be deadly to certain populations, we'd really like 0. But 191 doesn't rise to the high concern level. That is now our total cases, once we remove all the duplicates, 11,883. It's out of a total number of tests of 302,347, 302, 347. That's up significantly from yesterday. Again, we got a robust testing program. But I'm going to talk about that here in a minute. We got to make sure that we keep that up. Total number of Kentuckians ever hospitalized, 2,396. Currently, 508. One thing we track internally is also the total number of hospital beds that are taken and open in the state. They're not all taken by COVID-19, but we want to make sure there's enough room there that if we have a surge, that there are still enough beds open. That we can take care of everybody. Right now, we believe that there are certainly enough overall hospital beds. ICU, total number ever in it, 966, currently 68. Again, this number for COVID-19 has remained pretty low. We have not seen it increasing. And in at least 9 states, what we have seen is increasing hospitalizations due to COVID. in increasing folks in the ICU. We also see a very low number of people overall in Kentucky on ventilators, and that again has us more prepared if we see a surge. The total number recovered, 3,375. That's an exciting number, and again, this is only when we get reports back of people being recovered. Cases by county, new cases, Jefferson 49. They make up 25% of the cases today. That's the lowest percentage, I think, for Jefferson County for the last several days. Fayette County 36. They see their cases currently increasing. Only part of that is due to the federal prison. There's a real problem there. It's one that we can't directly respond to because it's under federal jurisdiction, but we are watching it and certainly hoping that they will work to stabilize it. Warren County, 22, continue to see significant cases out of Warren County. That's why we have left our testing facilities there. 6 in Jessamine County, 5 in Boone and Christian County, 4 in Franklin and Russell, 3 in Allen, Barron, Bullitt, Hart, Harrison, Logan, Ohio, and Woodford, and 2 in Bourbon, Clark, Clay, Davis, Gallatin, Mason, Nelson, Simpson, and 1 in Adair, Butler, Campbell, Edmondson, Henderson, Hopkins, Kenton, Lewis, Madison, Marion, McLean, Montgomery, Powell, Pulaski, Scott, Shelby, Trigg, and Whitley. What this tells us, which we've talked before, is it's everywhere around the state, but what this also tells us is we have testing everywhere around the state. There was a time when some counties didn't show up because we didn't have the testing availability within a certain range of people. Now we do. While the 191 number of today's cases is below the 250-ish we had yesterday, our deaths are up a little bit. We have 7 new deaths related to COVID-19. Those are 7 more Kentuckians that we've lost, 7 people whose families are mourning, and that we need to show our compassion, our green lights, and our bells at 10 a.m. They include 3 individuals from Logan County, all from the long-term care context, I believe. A 78-year-old woman, a 66-year-old man, a 79-year-old woman. All of those are Logan County. And then a 55-year-old woman from Simpson, an 83-year-old female from Jefferson, a 66-year-old male from LaRue, and an 84-year-old female from Hardin. We'd have to crunch the numbers, but it does appear that we have, at least by comparison, more folks in the last couple days in their 50s and 60s than we've seen in several weeks. So remember, especially if you fall into that at-risk category, just because things are open doesn't mean you ought to be going to them. You got to be really careful if you fall into any of those areas because of what this disease can do. The racial breakdown of cases, 72.97% white, 15.39% black, 5.95% multiracial, 5% Asian, and then ethnicity, 83.5% non-Hispanic and 16.5% Hispanic. On deaths, continues to show around the same racial disparity that we have seen, 79.35% white, 16.96% black, 1.96% multiracial, or 1.74% Asian. And then ethnicity is 96.5% non-Hispanic and 3.5% Hispanic. Again, this shows that while we need, and while I'm governor, we're going to work to ensure that everybody across Kentucky has some form of health care coverage. While I'm governor, I want to make that happen for everybody, because health care is a basic human right, and there is a form of coverage for everybody out there. It's just getting to you, providing you the options and the information. But when we got people dying at an unacceptable rate, at twice the makeup, even more, than the population, we all ought to understand a priority of where we start in signing people up. Let's look at the long-term care numbers. So there's a bit of an explanation here because They have dropped. We had one facility that had incorrectly reported cases. So this was finding that error. Residents are actually down 25, staff is down 5. And while we don't like errors in the data, we are at the mercy of those that input it. But listen, if the numbers are smaller, it's a good thing. It's a good thing. 6 additional deaths, all residents that can be attributed to long-term care facilities. All right, so we're today going to again talk about testing. Testing is absolutely critical if we want to open safely. Our current testing sites this is for the rest of this week, in Fayette, Jefferson, Bowling Green, and E-Town all have more room. This is next week. We'll talk about that. They all have more room. If you are in any of those areas and you go online right now at the Kroger site, you can sign up and probably get a test tomorrow in most of these areas. So get one. If you haven't ever had one, get one. If you haven't had one in about a month, get one. If you've started doing more things out there, get one. If you're somebody that's going back to work here soon, get one. It not only can help bring you peace of mind and ensure you're not spreading it to other people, it also helps us as a state to have the data that we need. So please, especially Bowling Green, which is open the next 2 days, Thursday and Friday, and E-Town that's open tomorrow, we have a lot of space. We need more people to sign up. Jefferson County still has some room tomorrow. We still see Jefferson performing real well, and a lot of room on Friday. Fayette County, any of the surrounding counties, you can come to it. Again, space tomorrow and Friday. Get online and sign up. This is the way we protect each other, and I certainly would want to know. I hope that you do too, and this is one of those things that we got to ask people to do to help us get through this pandemic together. Now, the Kroger sites are not the only sites. The reason that we are seeing this increase in testing, over 40,000 plus tests for the last 3 to 4 weeks, I think 4 weeks, is that we have more testing facilities now than ever before, 189 right now. This means everybody, absolutely everybody has a testing site close to them. So we have no excuses if we need a test. It's available. It is there. And let's make sure that we do it. Now, our Kroger drive-through testing sites, which is still our highest testing sites by volume, that start next week. We are continuing in Fayette, Jefferson, and Warren. Again, Fayette and Jefferson are serving very large areas that are very important, and we have people that are driving in, especially to the Fayette County site, right off, I believe, 75 and 64, right off 64. And then Warren County, where we've had a significant outbreak. And then next week we are also going to be in Oldham County. That was a request by the health department. There is a significant need there, and we look forward to that. Oldham County is going to be Tuesday, Wednesday, and Thursday. And we have, I believe, new summer hours. They start earlier in the morning, I believe now 7:30 when you go online, and they end about 2:30. That's for Kroger's workforce. They are still providing them at no cost to the Commonwealth. It has been Kroger's been a godsend for us, along with UPS and our various labs, of course, which we pay. But this, when we were struggling, I mean, truly struggling on the testing front, and this came through, that was just the start of a total change that we saw in the Commonwealth. As long as we got this pandemic, we got to test, we got to contact trace, which is picking up the phone, and we got to do our part as Kentuckians. I'll also say that if you've been out in a demonstration or in a march pushing for a better, safer world, we would really encourage you to get tested at any of these facilities. In just about all of them, it is completely free. Just a good idea to make sure that you are safe and healthy, which is exactly what we want. We're moving fast today. One other note, and this is outside of the COVID context, one of my first acts as governor was reforming Kentucky's Board of Education, wanting to ensure that we had a board with vast education experience and a board that would find a new commissioner through a national search where we could get the very best and not just hiring one of the governor's buddies. So again, and as with anything, that spawned a lawsuit about whether I had the authority. Today, the federal court in the Eastern District of Kentucky ruled in our favor, saying it was a valid reorganization. So we think that's behind us. The Senate confirmed all but one of the members, even in a time when there have been arguments about it. I thought that was a very bipartisan gesture led by Senator Stivers. It helped us move forward, and I think that we were going to have some dynamite candidates. Again, I'm not going to select any of them. That's going to be done by that Board of Education. Open it up to questions. We've got a couple of written questions, and then we've got Lawrence Smith, Chris Williams, Joe Sonka, Mike Valenti, and Joe Ragusa. And so we'll start over on the right, and there's going to be one question that Secretary Freelander is going to have to answer. So, Lawrence?
Do you have a date yet for expanding capacity for restaurants, things like that? And secondly, do you feel any pressure now that Indiana is accelerating this reopening program?
So the increasing of the restaurant to 50% was a month from the date that we did the 33%. I don't have that in front of me, but I know we've been in touch with the Restaurant Association. That date is set, and we can get it for you. I didn't write it down, but it's either 30 or 31 days. I know that we've gone over that. Do I feel pressure about what other states are doing? Well, certainly we want our economy to be competitive with the economies of the surrounding states, and in many indications, we're doing as well, if not better, at addressing the coronavirus than some of our bordering states. But I don't want to be the fastest. I want to be the safest. Now, there does get hype around reopening, where sometimes you'll get just a bit of info saying, they're reopening this. And then you look at it, and they're doing it at a lower capacity than we do. Kentucky Kingdom here is going to open before Kings Island in Ohio. Our state fair is going to be on when many others are not. And so when you look at the totality of reopening, while I believe we are being smart and deliberate and careful, I also don't think that there are vast differences with many others out there. Now those that I guess want it overall to be faster or say that it's faster can compare one small set. But we're trying to make our decisions based on how we know the virus spreads and how to do it as safely as we can. I answered the question on the Kentucky Board of Education. That means that the current members stay, the former members do not come back. That's all the news on that. Secretary Freelander, we've received a couple questions about Signature Healthcare. Apparently put out a press release saying it's laying off 100 staff from its office, and it blames it in part on the state for not providing a temporary increase in Medicaid through FMAP, as some states have done. It also says the state squandered our state resources on a multi-million-dollar COVID field hospital that has not been used. I'm going to let Secretary Freelander respond to most of that. But first, that field hospital was put in at a time when we were rapidly increasing in cases. And Lord, if we had not had that and we had become overwhelmed in our capacity in our hospitals, we would have seen our deaths increase dramatically. And that's something we couldn't let happen. And it's also still there. It's now providing a necessary backstop so that our hospitals can start doing elective procedures again. You know, when I look at total number of hospital beds, a whole lot of them aren't from COVID-19. They're from other surgeries and other procedures that are being done. Without having the backstop of that field hospital, the healthcare reopening would have had to look very different. We've also had to evacuate multiple senior facilities, including a Signature healthcare facility. And thank goodness we found a hospital to take them very quickly. Otherwise, the plan on these is to take them to the field hospital. There is not a connection in the two or where the funding comes from whatsoever. So with that, I'll turn it over to Secretary Freelander.
Thank you, Governor. And again, thank you for your aggressive response in terms of nursing facilities. As I talked about on Thursday, I think you can compare Kentucky's response, compare what we're seeing in Kentucky to the nation, and know that we have done a very good job. So, in terms of Signature, it is unfortunate that Signature feels that they need to lay off 100 folks in Louisville. But what I will say is this. We have provided a great amount of support to nursing facilities. Every facility has benefited from the fact that we have streamlined our eligibility process. Every facility benefits from the fact that we are providing testing at no charge. Every facility in Kentucky. Every facility in Kentucky benefits from the fact that we have extended bed hold days. I don't know of other states that have done that. We've also increased a daily rate for patients who are COVID positive to $270 above the base rate. I don't know of any other state that is more generous than we have been in this case. We have also provided ongoing support. We've worked with our partners, Norton's, and our local health departments and our public health departments to respond to facilities when they need assistance. And Signature has needed assistance, as have other facilities and other chains across the Commonwealth. So, while I'm sorry for that, I still believe Kentucky has provided an aggressive response for our nursing facilities, and I believe that to this day that is reflected in the numbers of how Kentucky compares to the rest of the nation.
Joe?
In regards to the election in Georgia, what's your kind of response to the problem there? And do you anticipate any issues similar to what they faced here in Kentucky with black polling places and sometimes?
Looking at the election in Georgia is troubling. It at least appears that a large contributing factor was not getting absentee ballots that were requested to people on time. It took a little bit for me to get mine, but my hope is that those are getting out and they will be timely. And it's going to be really important that on the 15th, the last day that you can request one, those get turned around and immediately get to people. Based on some numbers that I was hearing earlier today, there have been significant requests for that. We can get you that number. I believe that's going to be the key. I think that's going to be a bigger factor than just the number of polling locations. But we ought to look at what happened. And we ought to have our clerks start making plans or estimates to what they could potentially see due to this. And if that requires a change in course, we ought to be open to it. If we don't learn from other people's mistakes, then shame on us. Chris?
Governor, can you maybe refer to your notes, because I was trying to make note of when you were talking about statistics of deaths and sickness. What was your statistic for Hispanic population? Is it around 16%?
No, the overall deaths for Hispanic are, no, total cases. No, non-Hispanic 83, Hispanic 16 and a half, it says. That'd be a significant increase.
According to Pew Research, Hispanics make up about 3% of the Kentucky population. That's a 5% or 5 times what their rate would be. Have you considered giving more attention to the Hispanic population in Kentucky and maybe reaching out to them for health care the way you've done in recent days? Talking about other minority groups.
We are working in through local health departments with a lot of the Hispanic population. And oftentimes it's been in the meatpacking facilities that we've seen. And yes, I want to make sure that every Kentuckian has health care. I know that when we provide these tests and when we get people in, they're presented at any of these facilities with just the one page it takes to sign up for expanded Medicaid right now. Joe?
Knowing what you know now, do you regret
The question is on, do I regret sending the National Guard to Louisville, and do I bear responsibility for Mr. McAtee's death? When the National Guard was requested from the City of Louisville and LMPD, we had seen some significant escalation from a Thursday where we'd seen multiple people shot, not police officers, but multiple people shot, and then a Friday where we saw some significant damage and real concerns for violence. At that point, I believe that the Guard was necessary, and what could have happened, especially I think that was a Saturday night, it was important to have them there. Now, Mr. McAtee's life matters, and I hate that he is no longer here with us, and I hate that that situation happened, and certainly we all wish that it hadn't happened. But I'm still committed to ensuring that all of the facts come out on a transparent investigation where we continue to provide more information as it comes in. Hopefully by the end of that, everybody can look at that and make conclusions both as to the incident itself and if they want to evaluate my call on the National Guard. Certainly I wasn't involved in any decision to go to that location that night. That's made by LMPD and the folks on the ground.
Knowing what we know at this point, do you believe that David McAtee knew that he was shooting at police and
The question is based on what I know at this point. Do I believe that Mr. McAtee knew he was shooting at the police or the National Guard? I don't know what he thought in his head. And I don't want to suggest that I know what he thought in his head, and I don't know if we ever will. And to his family, so I really wish he was still with us. I think everybody does. I hope again that by being transparent, by providing facts and evidence as we go, and then trying to provide as much other evidence that puts it into context, that family and others can see that this is going to be an independent and transparent investigation. It's led by KSP. Michael Brown gets information on it, but it's led certainly by the team that does this all across the Commonwealth. Did I miss Lawrence? We'll come back to
On the National Guard question, is there anything you've learned from this experience that should apply next time a situation like this happens?
So just like when I've been asked questions about tear gas during during the protest, what I've said is we always have to be willing to look at policies and procedures to do better. And I'd encourage, and it's encouraging that we have seen at least one change in that. I'd also encourage LMPD or anybody else involved in these to sit down with those that have concerns about how things were carried out and listen to them. And we can always learn something from each other. Maybe we can explain things to each other as well. And maybe that lack of dialogue in other situations has been a contributing factor to where we are right now. A couple things are that ensuring that we have more control over the where the National Guard is deployed, and again, we're still getting more information on the why and the decision, but having more direct access to that information on an ongoing basis is something that I'd certainly want to see.
Quick follow-up.
Yeah.
Tear gas. You approve of the LMPD moves regarding tear gas that they made today?
I think that based on these demonstrations, we need to absolutely look at the when, the where, and the how the tear gas is used. And I think that generally law enforcement always wants to, or should always want, to go back and look at any incident and say, why did we do what we do? Could we have done it better? And I think this is a time where some real discussion has started, and it would be a good discussion for everybody involved. Now, we got to listen to each other, and we got to understand that sometimes what people are saying we might not initially like, but sometimes people just got to get that out, and then they can get to the to a type of discussion where we can make a real difference and real change.
Do we have any gauge yet as far as the
we do not have information on coronavirus stemming from the protests. It's too early. Now, there was some real significant testing done in Louisville, I think on Sunday or in the last couple days. And so we'll get those results here in the next couple days, or perhaps they've come in, but it also may take longer for symptoms to develop. Now, we are going to learn a lot about what outdoors may or may not do based on this. So it's still too early to tell. We do expect that when you get a lot of people together, that the virus could spread. Much of the population that I know was demonstrating are the lowest at risk of serious complications, but everybody needs to get tested, both to make sure they're okay, and it may teach us something that helps other people with COVID. Chris?
Jefferson Davis statue, are you removing it?
I believe that the Jefferson Davis statue should go. We are taking steps towards making that happen. I don't want another child to have to walk into this Commonwealth and feel like they are not a full part of this Commonwealth, that they are not as important as everybody else, or that we glorify a time where their relatives were enslaved. It's time.
What are those steps? You said something similar yesterday, but what are those steps and what's the timeline?
Well, it's what it's going to. I think we're going to have a little information on that, more than a little, at around noon tomorrow. Joe?
Kentucky's Attorney General says he thinks the investigation into David McAtee's shooting will conclude that the National Guard acted with a measured response. Do you agree with this assessment?
I believe that we need to collect all of the evidence, and that in the end, that in context will hopefully speak for itself and let everybody else reach those conclusions. I do want to make sure that all of it is in, and there's significant evidence still being collected. There are statements to review, there are the other body cameras that aren't likely to catch actual footage but may catch sound. The FBI is doing a big video compilation, which can be important. There's other ballistics that are going to come back on other weapons found in the house. I want to make sure, again, that that's transparent and we're able to put it all out there. One more time? Oh, I missed. Yeah, sorry.
The Kentucky NAACP wants to override sections of KRS 67 and KRS 15 and allow civilians to oversee police officers' conduct. Would you commit to issuing an executive order pertaining to that?
So I just got that letter today. We are analyzing the legal authority and ability to do that. I believe that there is a significant and robust discussion right now on civilian oversight and how it would work. It obviously takes some education, but we're analyzing right now both the request and the authority on an executive order to override an existing statute. That's something on the legal side we got to work through too. I'll do one more quick round.
Your thoughts on, there was a case of Nemus, part of a lawsuit that's been filed challenging the single voting process for the primary. Your thoughts on that?
Representative Nemus and others filed that lawsuit. I think it will, in the very least, create an important discussion. We don't control in the governor's office the number of polling locations that are out there, but if they believe there are compelling reasons, and there certainly could be, that don't put more people at risk, and there is an ability to do it with a shortage of poll workers that aren't at risk for COVID, I think that can be an important discussion. You know, unlike others, when folks file lawsuits just because I'm named in them, that doesn't bother me in and of itself. That's certainly a right for people to do. And as the governor's office, without the authority to make that happen, I don't think that we'll be one of the major players in the legal arguments.
Are you talking at all about what steps might need to be taken for the November election in lieu of all this?
So the November election is a very good question. We got a lot of time before it. We really need to see what happens in June and July, because at the end of June we open up significantly more, and we'll see where we are In November, with the number of people that are likely to vote, I do think that in the very least we would need more polling locations. But if COVID-19 is still out there the way it is right now, this same form of absentee ballots is going to be necessary. If we don't make it easy for people to vote, and especially those that are in harm's way because of this virus, then we're not living up to the bedrocks of our democracy. And we're basically disenfranchising people who could die from COVID if we're going to make them go into a polling place if the virus is still as aggressive as it is right now.
Are you confident with this portal to request absentee ballots that things are running smoothly and that there will be few, if not no hiccups with the portal and the absentee ballots going into what's becoming an unprecedented primary?
So the portal for absentee ballots is run by the Board of Elections. I have not heard from them any concerns, though it's a question you ought to ask them. And we haven't received those complaints in the governor's office. Now, I think what's really important is the turnaround and the timing. I got mine. I can't tell you how long exactly it took. I feel like it was about a week, but you're going to have to do better than that in the last week. So it's really important that our clerks, and I know that it's a lot of new work. It's important that they work to get those out. But right now, I believe that they are on track, and both the Board of Elections and the Secretary of State, I believe, are working hard towards it and need to be working hard.
We still speak to people who have waited months to talk to a person, get any kind of response on their unemployment claims. They can't get anyone on the line, they don't call them back, no one replies to the email, what they said. Is there a specific number or email address that those people who can't get any type of response can reach out to and actually get to talk to you?
Well, anyone you've heard from, you feel free to directly provide them to us, and then you can follow up on them with us. We'll be transparent about where things are to the extent that we can divulge certain data protected by law. We are continuing to process claims, continuing to process unemployment claims at a historic rate. The move to the Labor Cabinet, it's now under the effective control of the Labor Cabinet, we believe is providing additional resources that's there. We have a number of claims that there are issues under federal law that keep them from being processed as quickly. The communication about those challenges hadn't been where it should be and hadn't been where it needs to be. We got an office that part of it used to be 9 people, now facing just a deluge of claims, but we got to do better. I believe we are doing better, but there's still a large number of people out there that need to be helped. I think we got about 8,000 from March. All of those claims have complications, but if we're not communicating effectively with those folks, that's our fault.
When you say contact, you can call your office.
If you want to send an email to Crystal with the names that you're receiving, we're happy to go down that list and we'll check with unemployment on where it is. Last one.
Respond to the defund the police movement, and not the messaging and the hashtag, but rather the argument behind it, which says that counties and cities should reallocate funds from the police to social services.
Well, this concept of defund the police, I don't think is as much about taking dollars away from law enforcement as we throw law enforcement at problems that even law enforcement believes they shouldn't be addressing. When we don't address mental health in the way that we need to, what happens? A law enforcement individual is sent. The numbers that they're dealing with of individuals with mental health issues now is significantly more than it was before. And without the necessary social services there, sometimes there's no choice on what to do with an individual at that point. And that's a failure in society. I believe we do need to fund these other social services, address the root cause of so many issues. I don't necessarily think it has to be about reallocation, but it certainly has to be about very serious investment. It's what we have underfunded. And what we've seen with our budgets is everything has been cut. I mean, everything has been cut since 2007, actually before COVID, the very first budget we were going to have that didn't have cuts in it. And any new cuts was the one that we were going to get in this biennium. And so that means to address all those root causes, to have more dollars on both the local and the state budget, and we're going to have federal assistance in a stimulus and another CARES Act. If we don't have that, nobody's going to have enough money for anything over the next couple years.
Can I ask a follow-up on that? Because I think what he was asking was if you're talking about this push by some to defund the police, you're saying keep the police funding where it's at, but fund these other processes.
I believe that while there are different terms and phrases that are being used, what this is a real call for is funding of so many critical social services that go underfunded, and ultimately the police are the only unit that respond to someone who is having a mental health or another issue. I think that police officers all over the country would say we need to fund social programs like that. I don't think that necessarily means taking dollars away from one place. It means investing more dollars in another. And listen, any budget's a values document. And so dollars can come from any places. It's what we are underfunding that we see. It's laid bare. We underfunded public health for a long time, and we have seen that in COVID and how long it took for some parts of our federal government to respond, whether that's with testing or otherwise. All right, we got done in 45 minutes today, and I'm sure no one is upset about that. We are going to have another conference tomorrow, and then we will be off until Monday. Everybody out there, stay safe. Remember, COVID-19 is still out there. Remember, there's health care coverage out there for everyone. We just have to connect you with which type of coverage is best for you and what you qualify for. Let's make sure that we keep taking care of each other. We keep showing compassion. The WHO has walked back, and Dr. Fauci has specifically disagreed with their concepts on asymptomatic spread, so a mask is still critically important. Protect yourself, protect other people. We will see you tomorrow at 4.